jungle. Injuries and medical emergencies can happen unexpectedly, and knowing basic first aid procedures can make a significant difference in the outcome. This guide will cover the essential first aid step for 3 common scenarios: ankle injuries, knee dislocation, and heat exhaustion. Understanding these procedures can help you provide immediate care and potentially prevent further complications until professional medical help arrives.
Ankle injuries are common, ranging from mild sprains to severe fractures. The first aid procedure for an ankle injury focuses on reducing swelling, pain, and further damage while seeking medical attention. We have the RICE method. Number 1. Rest. Immediately stop any activity that caused the injury and avoid putting weight on the ankle. Number 2 is ice. Apply ice to the injured area for 20 minutes at a time. Number 3. Compression. Use a compression bandage to support the ankle and reduce swelling. And number 4 is elevation. Keep the ankle elevated above the heart whenever possible.
Number 2. Knee dislocation. A knee dislocation is a serious injury that requires immediate medical attention. The first aid procedure focuses on stabilizing the joint and preventing further damage while waiting for emergency medical services. Number 1. Call for emergency help. Immediately call 911 or your local emergency number and do not attend. If do not attend, to move the person unless absolutely necessary. Number 2. Control swelling. Apply ice to the injured area to reduce swelling and the pain. Wrap the ice in a towel or cloth to prevent direct contact with the skin. Apply ice for 20 minutes at times several times a day. Number 3. Immobilize the dislocation. Immobilize the leg above the below injured the knee. This can be done using cardboard, magazines, or other stuffed materials as split. Do not attempt to push the knee back into its original position. Manipulating a dislocation joint can cause severe injury. Number 4. Follow-up. At the hospital, a doctor will realign the joint possibly under anesthesia and assess the extent of damage to the bones and surrounding tissues.
Heat exhaustion occurs when the body overheats and loses fluids, leading to symptoms like dizziness, fatigue, and nausea. First aid for heat exhaustion focuses on cooling the person down and replenishing. Number 1. Move to a cool place. Immediately move the person out of the heat and into a shady or air-conditioned place. Number 2. Lay down and elevate legs. Lay the person down and raise their legs and feet slightly. This helps improve blood flow to the brain. Number 3. Remove tight clothing. Remove any tight or heavy clothing to help the person cool down. Number 4. Hydrate. Have the person sip chilled water, a sport drink containing electrolytes, or another non-alcoholic beverage without caffeine. Number 5. Cool the person down. Cool the person by spraying or sponging them with a cool water and fanning them. Number 6. Monitor carefully. Monitor the person carefully for any worsening symptoms or signs of heat stroke, such as confusing, agitation, or a core body temperature of 104 degrees Fahrenheit. If these symptoms develop, call 911 immediately.
In conclusion, being prepared for common injuries and medical emergencies can make a significant difference in the outcome. By understanding the basic first aid procedures for ankle injuries, wrist dislocations, and heat exhaustion, you can provide immediate care and potentially prevent serious complications. Remember to always seek professional professional medical attention after providing initial first aid.